To date, we have identified 29 community cases associated with the January Omicron cluster. All are in isolation. Investigations into the source of the cluster are continuing, but we are yet to establish firm links to a known border case. And whole genome sequencing for Omicron may make it difficult for us, in fact, to ever establish the source of the outbreak. Today, Cabinet has agreed to enhance the mask-wearing protocols in the red setting of the Covid-19 protection framework to further assist in the slowdown of Omicron. Today, I can announce the following changes to mask-wearing at red. Masks must now be worn at food and drink businesses, close proximity businesses, events and gatherings. The existing exception of when you are eating and drinking and exercising still apply. We are, for instance, asking people at restaurants when they enter or when they get up to use the bathroom to use masks. These changes also won't apply to non-public facing workplaces, swimming pools, and gatherings where you have the exclusive use of a premises. We really do encourage all workplaces, though, to think about mask use policies that protect your workforce, and I know many businesses are already doing so. We're also now requiring that a face covering be an actual mask. That means no more scarves, bandanas, or as some of us may have seen from time to time, T-shirts pulled up over the face, for example. This is to ensure that it is a mask designed to cover your nose and mouth properly. All workers who are legally mandated to be vaccinated must now also wear a medical grade mask. For example, a type 2R or level 2 mask or above while working in public-facing roles. So that includes, for instance, the widely available blue medical grade mask that many are already wearing. As you know, all primary and secondary school students, year 4 and up, are already required to wear a mask. For consistency, they will now also need to wear a mask on Ministry of Education funded school transport services and public transport. I know that some of these adjustments might cause challenges, but the science has been updated and these adjustments will slow the spread of the virus, save lives and give us time to get more of the eligible population boosted. These changes will not come into force until 9 days' time. That allows these changes to be gazetted, but it also allows workforces in particular, time to prepare and ensure that they have access to what are widely available medical grade masks. The Ministry of Health will also be updating guidance on masks for the public. How to safely reuse masks, for instance, because it is possible to reuse many masks safely if done properly and ensure the best fit. My final word on masks. We've looked at a lot of overseas data on who is most successfully managing Omicron. Masks play a significant role when done right. Now, we've made a major shift in New Zealand by adopting their widespread use. Now we just need to tighten them up slightly so we get the best out of this really important measure. Tomorrow, Minister Vera will set out our response to Omicron across the 3 likely phases we will experience. As I previously set out, in phase 1, the early stages, which we are in now, we will continue with the same testing, tracing and isolation settings as we have used before. That's because this helps us to slow Omicron down. But as case load grows, these settings will change. Looking to outbreaks around the world, we've seen that where this is most important is critical workforces such as healthcare, supermarkets, supply chains and other industries and services critical to delivering the necessities of life. Today I can confirm how we intend to use rapid antigen testing to help critical workforces, businesses and supply chains stay open. And this is to allow a test to return to work approach. This approach will mean that critical workers who are identified as close contacts will be able to use proof of a negative rapid antigen test to return to the workplace during their required period of isolation. This will minimise disruption to critical infrastructure and supply chains, helping to keep New Zealand going. But we're also focused on making sure that we apply it to those who are deemed critical, so we reduce the risk of people being exposed to a contact who still may have COVID-19. For now, though, PCR tests are best. We need their accuracy to hone in on the spread while Omicron is in its infancy and can be slowed. And in preparation, we've significantly increased our PCR or nasal swab testing capacity. We can do 60,000 tests a day, with surge capacity to just nearly 78,000 tests a day, which can be sustained at a surge rate for approximately 7 days. Once we reach phase 2 of the outbreak and Omicron is more widespread in the community, rapid antigen tests will be more common in our testing strategy. We have 83 million rapid antigen tests on order amid huge global demand. We continue to pull out all the stops to secure what we need here in New Zealand. In total, as I've already set out, New Zealand has 4.6 million in country. We have confirmed delivery of an additional 14.6 million over the next 5 weeks. On top of that, we are awaiting the delivery schedule for an additional 22 million over the same period. So that's more than 40 million tests for a 5-week period in total. We continue, as does just about every country at present, to seek additional supply. But as you will have heard, it is a very competitive space for rapid antigen tests currently. There are currently 9 types of rapid antigen tests approved by the Ministry of Health for use. A further 19 are under full technical assessment. Now, this is an important process, as the effectiveness of rapid antigen tests can range from 30% 40 million tests, additional 22 million over the same period. So that's more than 40 million tests for a 5-week period in total. We continue, as does just about every country at present, to seek additional supply. But as you will have heard, it is a very competitive space for rapid antigen tests currently. There are currently 9 types of rapid antigen tests approved by the Ministry of Health for use. A further 19 are under full technical assessment. Now, this is an important process, as the effectiveness of rapid antigen tests can range from 30% accuracy through to 80% accuracy. We'll also continue to do what we can, though, to of course support businesses who, whilst they are able to seek supply of rapid antigen tests directly from manufacturers, we know that it is difficult for many to secure that supply. So whilst we, for critical workforces, will support them by providing rapid antigen tests, we continue to encourage those businesses to also do what they can to help manage the health of their workforces and draw up contingency planning for their workforces. Further today, you would have seen the work done to secure CO2 monitors and 5,000 portable air cleaners for our schools to keep them open, keep our kids learning whilst reducing the threat of Omicron in our schools. Those CO2 monitors will help us assess the quality of ventilation in different classrooms, and schools will be able to adapt their ventilation plans to make sure they've got good through flow to reduce the spread of Omicron within the school environment.
Just to add that our guidance for the public will be very much around that, ensuring that whatever mask you have, it's well-fitting, and that could be a good 3-layer reusable mask or a medical surgical mask, or a combination of both actually, to help with, which is really to help with a good fit. We're not going to be recommending the use of N95s for the general public in going about your daily business, partly because they are expensive and they are harder to get, but some people may choose to do so, in which case we will be providing good advice about how to get a good fit to make sure it is as safe as possible if you are using an N95. For those people that will be required to use masks in certain settings under the red, in certain places under the red setting, that will be a medical grade or surgical grade mask that meets certain standards. The advice for the public will be around the use of a reusable mask that is a 3-layer, and most of those are material, but that is important. And in some, that layer is a filter that one can insert and replace.
Nearly 60% of eligible New Zealanders have now had their booster, and 1 in 5 children under 12 have had their first dose from yesterday's data. Bookings in the system are high at 262,000, for which 186,000 are boosters at over 1,000 sites, with extra vaccination clinics such as Auckland's Westgate and Mount Wellington vaccination sites shifting to drive-through this week to increase capacity. You can, of course, as always, book now for your booster at bookmyvaccine.nz or find a walk-in or drive-through at healthpoint.co.nz. Now, we know from overseas experience that time is of the essence with Omicron. Boosters and basic infection control can slow it down in this stage. So if you do your booster, if it's been 4 months or more since you got your second shot, please get in there as soon as possible. It will keep you safe from serious illness and it will preserve our hospitals. It's pleasing though to see that over 73% of eligible people over 65 have now been boosted. And every DHB is on track to complete their booster programs in aged residential care facilities within the next week. This is important because, as we saw with Delta around the world, high rates of vaccination among older population and those at greatest risk of serious illness play a major role in preventing widespread outbreaks. And so my message to over 65s is let's do that again. Let's reduce the threat of Omicron just as we did for Delta. Basic infection control also plays a really important part in minimising the threat: hand washing, distancing, masks.